Good morning, everyone. I want to add to Frank Lloyd's thanks to our sponsors, but also to our volunteers and members of the Roundtable who have come together to put this workshop together today, which is going to be quite exciting. And also the Roundtable staff who also have worked very hard. I don't see them all here, but Kathleen Stratton, there she is. Hello. I think I saw Erin here somewhere. Hi, Erin, and Hope Hare, who the three of them have done a marvelous job, and also the director of the board under which this roundtable operates, Rose Martinez, who's here very much in support of this. The Board on Population Health and Public Health has been a very nice home for this roundtable, and we appreciate that. So today we're going to have an opportunity to talk about public health in the context of urban revitalization. And I'm particularly excited about this because of what I've seen as a major trend across the country of people moving back into cities. After many decades in which our cities were undergoing population loss, and in some cases not just decline but near collapse in the viability of some of the cities in the country, and that we suddenly are in an era where young people are interested in living in cities. For example, young people, many of whom grew up in suburbs, don't want to live far from where they work. They want to be in neighborhoods that are walkable. They want to be able to bicycle. They want to be able to congregate in places where they can meet people from many cultures, from many parts of the world. At the same time, older people have become interested in living in cities. And we have a whole movement globally now of cities becoming more aging friendly. And people have become to recognize that living out in suburbs is not necessarily the best thing as we age in terms of access to services, access to social environments, the ability to if you may, age in a way that's very healthy and perhaps even allows people to move on to second careers or second lives after their first lives. And so there's a lot of focus on urban living, a lot of focus on urban environments, and along with that comes the opportunity to make urban communities healthier. So that's a positive way of looking at this. Another way of looking at this as well, though, is the fact that many of our cities have experienced disasters either slow-moving or very rapidly. And I think that's true of the three cities we're going to talk about today. Washington, D.C., for a long, long time, suffered from population loss and poor economic and educational opportunities in many of the communities, and if you may, a population that strove to move out of Washington to become well off enough to go somewhere else, out into the suburbs. And so, although it was very slow moving, I would say that this had been a disaster for the city. Detroit, on the other hand, experienced a very rapid set of changes due to collapse of the major industry in that region, the automobile industry, and so a much shorter term timeline for something that's been quite a downturn for that city. And then New York, although all of New York hasn't been affected by it, but certainly parts of New York in the wake of Hurricane Sandy certainly received major and very sudden negative impacts. And I think what these three have in common is that, during a time where people want to live in cities and at the same time the need to rebuild in these cities, providing an opportunity to do that in completely different ways, to use new approaches, if you may, that promote health. So in a sense, this is the theme for the day, but I think as we're going to hear from these 3 case studies, we're going to hear about very different approaches. We're going to hear about very unique ideas that people have been bringing to the fore, and a lot of creative energy that has been stimulated by the opportunities that are inherent in not only the ability to invest in these cities because of the fact that people want to live in them, but also the idea that we can do that in a way that's been completely different. So as a resident of the Washington, D.C. area and somebody who works in Washington, I'm very pleased that we're going to start out with a session about Washington, D.C. And I've been struck as somebody who works in the city at how easy it is to get along here without an automobile, to use public transportation, and how every year it's easier to walk, it's easier to cycle, and it's hard, actually, not to get the numbers of steps in every day that I want to get as part of my own personal objective of getting a lot of physical activity in my day. And at the same time, I've also been struck here at the huge disparities between those in Washington, D.C., who are very, very educated and very, very well off, and those in Washington, D.C., who have had less access to education, less income, and harder time accessing opportunities for good health. So Washington, D.C. does bring a lot of important opportunities for public health, and I'm very pleased that we have 2 people who are going to talk about those opportunities and how they're addressing them in very different ways. And I'm going to introduce both speakers and then have them come up and speak one after the other. The first is Greg Katz. Greg is a friend, and he's president of Capital E, which is a national clean energy advisory and venture capital firm. At one point, he was director of financing for energy efficiency and renewable energy at the U.S. Department of Energy, where he led national programs. Since that time, he has been involved in a number of both for-profit and not-for-profit activities that are somehow related either to renewable energy or the development of green communities or green building standards. There's a long list of accomplishments that he's had in that context. He has an MBA from Stanford University and an M.P.H. from Princeton University. Our second speaker, Brendan Shane, is a JD and is director of the Office of Policy and Sustainability at the District of Columbia Department of the Environment. Brendan is responsible for developing policy and programs in waste management, renewable and clean energy, climate, and green buildings. He is a principal staffer for the Mayor's Sustainable DC initiative, working across the district government and community stakeholders to define and implement the mayor's vision of making the district the greenest city in the nation. He has a law degree from Georgetown University and an MS in geology from the University of Maryland, College Park. And I should say, you know, as somebody who not only lives in the area but also recently was involved with construction of a building, his initiatives are very, very real to those of us on the ground who are actually doing development work, doing building. And it's been truly phenomenal to see how effective the district government has become in promoting greener development. So I guess, Greg, please come forward.